Children. They are one of our country's most precious natural resources. Our hope for the future. Every 13 minutes in Wisconsin, a child is reported abused or neglected. Sadly, the number of children abused or neglected in Wisconsin annually will equal the population of Brookfield, Wausau, or Fond du Lac. We often hear about the strides that agencies are making to reduce the problem of child abuse in Wisconsin and our local communities. What we don't hear often enough is how organizations are helping child abuse victims and their families heal from the trauma of abuse and neglect and move forward with their lives. The Chippewa Valley Child Advocacy Center in Eau Claire is charged with the very important job of providing services to victims of child abuse in a comfortable and friendly setting that is focused on the needs of the child. The Child Advocacy Center is one of several centers throughout Wisconsin that help children and their families begin to recover from abuse while providing community leadership and child advocacy.
That really is the purpose of the Child Advocacy Center, is to bring together a lot of different agencies in true partnerships to try to do a really good job of investigating, certainly, but also to do a really good job of helping children and family heal and recover from what's happened to them.
When you have one central location, such as the Chippewa Valley Child Advocacy Center here in Eau Claire, you have surroundings that are not as intimidating to a child victim or to a family who's in this situation. And you can accomplish everything you need without the child having to feel intimidated by their surroundings.
The Child Advocacy Center is a unique partnership between Children's Hospital and Health System and several community partners. Physicians, nurses, social workers, forensic interviewers, police, family advocates, therapists, and educators work hand in hand to provide victims and their families with services in one location.
The approach of the Child Advocacy Center really helps the whole family so that the investigation doesn't drag on, so that the family isn't required to take the child to a number of different interviews, but that instead the team can work together and make sure all of the evidence and all of the information that's needed to proceed forward and to identify what might be needed in the way of treatment for both the child and the family.
Every child who's brought to the Child Advocacy Center is offered a complete medical screening and assessment conducted by experts in the medical, nursing, and social work fields.
The CPC is a place where all of the professionals there have special expertise in evaluating children who have been physically abused or sexually abused or even neglected, because this is the focus of really some highly trained professionals who know how to help the child feel more comfortable, can adequately evaluate the child medically and get treatment as needed, can adequately identify other injuries if other injuries are present that maybe the parent was unaware of, and that's not unusual, and then target maybe mental health needs. So it's not only the beginning of the investigation, but it's also the beginning of the healing for that child.
One of the values of the Child Advocacy Center is that it does offer one place, because it enables us to move in a very timely way to capture the evidence that's needed, to capture the information about the alleged abuse that's needed. And of course, the outcome is to not re-traumatize the victim, but at the same time we want to gather the information that we need so that the legal aspect of this can be appropriately responded to.
Another critical component of the Child Advocacy Center is the forensic interview. A skilled social worker talks with suspected abuse victims about their experiences in a child-friendly setting. This interview is taped and is part of the child abuse investigation. Forensic interviews are provided to the court so that children may only have to speak about the abuse one time.
it's extremely important to have the Chippewa Valley Child Advocacy Center as a place that we can use. Not only the Eau Claire Police Department and the investigators that I work with, but also the surrounding communities can use this, and it's a valuable tool because we know that all the equipment is here. We know that the setup is a non-intrusive setting, and it's a valuable tool, knowing that when we walk away we're going to have a disc with that whole interview with very good quality, and that can be used as evidence in any case that we may work.
Forensic examination is a nationally accepted model for how to interview children so that you can minimize the trauma but get to the truth, and do that in a setting that reduces the long-term damage to the child and yet still gives the prosecution the ability to present that evidence in court and do that in a constitutionally sound manner.
Experience has shown that the team-centered approach at the center improves the treatment and investigative process while providing better service to the child abuse victims and their families.
The more that we can respond in a positive or decisive manner to the situation, to get through the investigative phase and get into more of a healing phase, that more quickly that can be done, the better. And so I think that's the kind of advantage that a Child Advocacy Center presents.
The Child Advocacy Center's emphasis on collaboration and its unique delivery of services has proven to be the most cost-effective method of treating abused and neglected children. A study conducted by the National Children's Advocacy Center in partnership with National Children's Alliance has shown that the team approach to service delivery costs nearly 36% less than traditional treatment and investigation methods. The results are rewarding.
What we know from personal experience, from professional experience, and from the very best of the experts is that children need an environment that they can express themselves, because again, they are the most vulnerable of all the victims. They have the greatest difficulty expressing themselves. They have the lowest ability to understand what's happening to them. And so we have to give them an environment that's going to allow them to tell their story in a way that it's going to be heard by the public, it's going to be heard by a jury, and they're going to understand exactly what happened and be able to do the right thing.
Giving children a voice, providing guidance and support through the healing process, breaking down the barriers to helpful services. This is a story worth telling. Children's Hospital and Health System's Child Advocacy Centers, making a difference in the lives of thousands of Wisconsin children and families each year.